Do you worry your teen is gaining weight quickly or seems hungry all the time? Are you afraid this could lead to prediabetes or diabetes later in life? That's why I created the Healthy Weight Starts with Healthy Habits, a 7-day hormone reset program for teens. In just 7 days, teens begin to understand their hunger signals, learn how to build meals that keep them full longer, improve their sleep habits, and feel more confident making healthy choices. Instead of guessing what to do, your teen will have a clear starting point and simple habits that support their metabolism and long-term health. You can learn more at lifestyleforteens.com/reset.
This is the Lifestyle and Weight Loss for Teens podcast. If you're a mom and want to help your child who is struggling to lose weight, you are in the right place. If you are looking for healthy lifestyle tips, Dr. Gorgery is here to help you understand the science around safe weight loss in teens and children. Because what works for adult weight loss is not always the best for children. This podcast is for educational purposes only. Dr. Gorgery does not provide medical, psychological, or nutrition therapy advice. You should not use this information to diagnose or treat any health problems without consulting your own medical practitioner. And now, your host, Dr. Jenny Gorgery.
Hello, welcome to another episode of the Lifestyle and Weight Loss for Teens podcast. This is Dr. Jenny Gorgery, and today I'm talking about prediabetes. Can a 13-year-old girl have prediabetes? Can a 14-year-old boy have prediabetes? What is the difference between prediabetes and diabetes? What are the warning signs of prediabetes that parents should be aware of? So let's get into that. And first of all, I wanted to talk about how common is prediabetes today, particularly in United States. Unfortunately, the rates of prediabetes and diabetes have been increased compared to what was going on several years ago. It used to be more close to 11% of teenagers, but now the rate is actually much higher, up to 36% of teenagers can have prediabetes. So approximately a third of teenagers. That's like a huge number. Now, what is prediabetes? Prediabetes means that your blood sugar is a little elevated, but not to the point to be so much elevated that you have diabetes. And it is a stage before you develop diabetes. You don't necessarily need to get medications in order to treat prediabetes, although sometimes when severe cases, we do treat with medications. What are some of the symptoms that kids can have when they have prediabetes? I'm going to talk about that right away. But before I get that, I would like to mention another very important point, because I always like to focus on the positive thing here, right? I told you that the prediabetes is a stage before you get diabetes. But I also want to say that up to 25 to 50% of teenagers that have prediabetes can actually reverse that and go to normal glycemia, go to a normal sugar. And instead of progressing to diabetes, they can go back to normal. So if your doctor has told you that your child has prediabetes, that is something to obviously take very seriously, but at the same time, you can change it. That your teen can make changes to change it. It's still a reversible condition. And as I said, up to 50% can even go back to normal with no medications oftentimes. Now, the higher the severity of the prediabetes, the more difficult it is to get it back to normal. So how do we measure prediabetes? You can ask your doctor. There's a test called hemoglobin A1C, and that is what doctors use to measure to measure the severity of prediabetes and also diabetes. The hemoglobin A1C is a test that measures how much sugar is basically bound on your red blood cells. And if you have a lot of sugar in your blood, there is more sugar in your red blood cells. So that increases what we call hemoglobin A1C glycosylated. So that's sugar and that sits on your red blood cells. A normal hemoglobin A1C is anything that is up to 5.6%. And if it is 5.7 to 6.4, this is the range that we call prediabetes. And if the hemoglobin A1C is more than 6.5, that is diabetes. And so if you have concerns that your child may have prediabetes, you can ask your doctor. It's a simple test that can measure a hemoglobin A1C. Now, how high is the hemoglobin A1C? As I said, is very important in terms of prognosis. The higher the hemoglobin A1C, particularly those teenagers that have a hemoglobin A1C that is more than 6, so 6.1, 6.2, 6.3, 6.4, those are the teenagers that are at extremely high risks to get diabetes type 2 in the next 5 years. The ones that have lower hemoglobin A1C, it's easier for them to reverse to normal and don't progress to diabetes if they make lifestyle modifications, if they make the changes that they are supposed to make. And of course, some of them can, instead of improving, they can get worse. Like if you have a 5.7 A1C, it can go both ways. It can go 5.9, it can go 5.4. But the important message here is that it is still a reversible condition. So don't be scared if your child was diagnosed with prediabetes. It doesn't mean that there's nothing you can do. There are a lot of things you can do, and it is a reversible condition. Now, what are some of the risks or what are some of the signs that you can tell if your teenager has prediabetes? How do you know if your teenager has prediabetes? And I will say that oftentimes teenagers that have prediabetes may have no symptoms at all. It's not the same as diabetes, where people are thirsty, they pee a lot, they drink a lot, and all those things. You may have no symptoms as a prediabetes, and that's because your sugar is not that high yet to make you feel so thirsty. So that's why you don't see those symptoms. So oftentimes, unless you ask your doctor to check your child for prediabetes, you may not know that your child has prediabetes. However, there are some other potential signs. We call those soft signs or risk factors. One of them is the darkening around the skin. So you may notice that your child may have dark skin around the neck. They may also have dark skin under the armpits. Sometimes we also see that in the stomach area, in the groin area, and it looks like kind of dirt, but it's not actually dirt. And I talked about this on a previous episode, a couple of episodes ago. You can go and listen. It's episode 89, what the darkening of the skin means. But that could be one possible sign of a child that has prediabetes. Another thing that increases the risk for prediabetes is if the child is on an unhealthy BMI. If the BMI is high, that increases the risk for prediabetes compared to kids that don't have high BMI. And if you don't know what BMI is, I invite you to go and check episode 1 on the Lifestyle for Teens podcast, where I talked about what is normal BMI and how much weight does a teenager need to lose to be in a healthy weight. Now, it is an important risk factor if your body mass index and body mass of a teenager is more than the 85th percentile. Now, there are teenagers that have normal BMI and they can still have a little bit of prediabetes. That is not uncommon, particularly in teenagers, that they are at the peak of their growth spurt, at the peak of their puberty. And that is because high growth hormone creates a state of insulin resistance, and that can cause a transient increase in the blood sugar, rarely to the point that it is diabetes, but you may see some transient high hemoglobin A1C that is because of the puberty. Now, another risk factor that families should take into account when they evaluate whether a child is at high risk to develop diabetes is if there's family history of type 2 diabetes. Having family history of any disease actually can increase the risk for this particular disease in majority of cases, where there's a lot of people that have type 2 diabetes and we have a child that has prediabetes, we know that this child is of particular risk to develop diabetes. So again, evaluate that if that is the case for your teenager. Another thing is, how is the fat distributed in the body? So some kids, you can see that they may be heavier, but the fat tissue is distributed all over the body. And there may be some kids that they may be heavier, but the fat distribution is mainly around the stomach. Now, we call this central obesity. We call this central adiposity. And this is the type that indicates there is more fat tissue around the major organs inside the body. Particularly, I'm talking about fat around the liver. That can cause fatty liver disease. It can cause insulin resistance, and it is associated with a higher risk for type 2 diabetes, a higher risk for the prediabetes to become diabetes if there is central adiposity, because it increases insulin resistance. We call this also visceral adiposity. So there may be different names that you may come across that. Another thing that is important is to evaluate if the child has other risk factors like high blood pressure or high cholesterol or high fasting insulin. Those are things that overall give the signal of a metabolic dysregulation. And when there is metabolic dysregulation, there is a higher risk for prediabetes to become diabetes because of metabolic syndrome, as we call it. Now, another thing is, if you're a mom and you had gestational diabetes, or if your blood sugar was high when you were pregnant, because pregnancy is also a state of insulin resistance, that also may be a sign that you have genes or predisposition to develop diabetes, and that may also carry on for your kids. I mentioned already that the pubertal stage is important, and there is some form of insulin resistance that happens physiologically during puberty. And finally, I want to mention that if there are cases of, let's say, families that they don't have enough food to eat, that they don't have insurance, that they don't have primary doctor to take care of them, they don't have enough money, like they live in poor countries or in poor cities, those kids can be at higher risk, mainly because there is not enough care for those kids to prevent them and do the intervention that is necessary to get to a healthier metabolic state. So I know I mentioned too much too quickly, so let me just summarize. What are the signs of a teenager that has prediabetes, and what are some of the risk factors that can make prediabetes turn into diabetes? That would be if the weight is abnormal, there is high BMI, if there is family history of type 2 diabetes, if there is darkening around the neck or under the axilla, if there has been central adiposity or more fat around the stomach, the belly area, if there's elevated blood pressure, elevated cholesterol, if there has been history of diabetes in the mom when they were pregnant with the child, if the child is in puberty, and if there are some adverse social determinants, as we call it. Now, again, the best thing to know is to ask your doctor to check your child for a hemoglobin A1C to check if they have prediabetes. Now, your doctor can do the evaluation and decide whether your child, depending on their age, has any risk factors, and it's worth checking for prediabetes. Not, of course, the majority of kids, still 2/3 of them don't have prediabetes. So I'm not saying that every single child should be checked for prediabetes, but if there are children, particularly the children that are overweight or the children that have risk factors, I would recommend you have a discussion with your medical professional whether it's worth checking this child for prediabetes. Now, if you worry that, let's say that your child, you do the testing and your child does have prediabetes, and you want to avoid the progression for diabetes, there are several things you can do. And the first thing is lifestyle modification. Is watching in my mini Lifestyle for Teens course and also in my more extensive Lifestyle for Teens Full Transformation 100 Days program. If you want to learn more about it, I invite you to go check out lifestyleforteens.com/reset. It's like a quick reset for 7 days to just get a quick start and just the basics. And then if you want more in-depth lifestyle modification, that's why I created this 100 Days Live program. And by listening to this podcast, I have lots of tips on how to prevent this progression to prediabetes. That's all my professional life. That's what I study for. That's why I want to educate you through this podcast. Please reach out to me if there are any specific questions you would like me to answer. I'd be happy to do that. You can go to lifestyleforteens.com and go on contact. There's a contact me form. Please go there, send me a message. And if you're listening this on your podcast, I would really much appreciate if you can post a review. It would really help other people find my podcast so we can reach more people. That's all I had for you today. Hope that was helpful. I'll talk to you next week. Take care.
If you enjoyed listening to this podcast, I invite you to come check out the LIFT program. It's Dr. Gorgory's 12-week coaching program for teens and their moms, where we take all this information, we apply it to your daily life, and we work together so your teenager learns how to create a healthy lifestyle so they can feel happier, more confident, less stressed, and love their body again. Visit the website at lifestyleforteens.com and click on the Work With Me and free resources to learn more about this program and get free help to start this journey right away. Thanks for tuning in, and we'll catch you in the next episode of Lifestyle and Weight Loss for Teens.